Assalamu alaikum, my name is Yasser Hamdoun, third year medical student. I was asked to perform a physical examination on your digestive tract. I will stand on the right side of the patient and explain the procedure. That will include me exposing the area from the suprapubic region and above, and me touching your face, neck, and your hands and arms, and as well as performing some special tests. I will wash my hand and inspect the patient generally. The patient doesn't look in any distress, and there are no signs of jaundice, paleness, or cyanosis. I will check for any IV fluids or nasogastric tubes attached to the patient, as well as vomit bowels around the patient. I will check for the patient general body build, which is normal. Next, I will check for his mental status, that he is not confused and that he is well oriented. Next, I will ask the patient to extend his arm to examine his fingernails, that there are no signs of leukonychia, chylonychia, as well as asking the patient to do like this for checking for finger clubbing. And I will see the palmar side of the patient's hands to check for any palmar erythema, as well as paleness and jaundice. And I will check for the pituitary contractures. Next, I will ask the patient to extend his arms and dorsiflex it to check for any hepatic flap, which will indicate ataraxis. Next, I will examine the patient's forearms and arms to check for any bruising, any petechia, or any ecchymosis, as well as scratch marks and spider nevi. Next, I will examine the patient's eyes to check for any paleness in his conjunctiva, which is a sign of anemia, as well as examining the sclera of the patient. If it's yellow, it will indicate jaundice. Next, I will look for any xanthelasmas around the eye, as well as Kaiser's fissures around the pupils. Next, I will ask the patient to open his mouth to examine his mouth, looking for any breath smells or for any jaundice, paleness, or cyanosis. And I will check the teeth for any for his dental hygiene, as well as checking the oral mucosa and the tongue, and check for any ulcers. And I will check for the health of the pharynx. Next, I will check the patient's salivary glands for any enlargement, specifically the parotid gland, which is anterior to the ear, directly anterior to the ear, and the patient's submandibular gland, which is on the jawline, under the jawline. Next, I will check for the cervical lymph nodes, all 8 of them. First, I will examine the submental lymph node, then the submandibular lymph nodes below the jaw, then the preauricular lymph nodes anterior to the ear, then the posterior auricular lymph nodes behind the ear, then the occipital lymph node, which is behind the head, then to the cervical chain or the jugular chain. First the superficial cervical, then the deep cervical lymph nodes. Next, I will check for the triangular posterior triangle lymph nodes, and lastly the supraclavicular lymph nodes, which is above the clavicle. And to conclude my examination, I will have to perform an hernia orifices examination and to perform a testicular examination if the patient is a male, and perform a pre-rectal examination. And this is conclusion of my examination.
Assalamu alaikum. I'm Nawaf Al-Hayyan, I'm third year medical student. I was asked to give you a local examination of the GIT. This will include inspection, percussion, auscultation, and palpation. So do I have your consent? Thank you. First, I should wash my hand, stand on the right side of the patient. The patient should be supine, exposing the area. First, I'm going to start with inspection. Patient has no scars, no stria, no distension. The contour seems to be normal. I should check the umbilical morphology, which appears to be normal. There are no veins visible and no pulsations visible. Then I should ask the patient to cuff. So could you please cuff? And the patient has no pain while cuffing. Then I'm going to perform the straight leg raising by raising the right leg. If there is pain in the right iliac fossa, this indicates appendicitis, so there is no pain. Moving to light palpation, I should palpate the 9 regions. Light palpation to check for masses, and I should check the patient's face to so if there's facial expressions indicating tenderness, and I should also check for gardening. Then for deep palpation, same 9 regions, but deeper, to check for the size, shape, and consistency of any masses. Then for knee rebound tenderness, I'm gonna palpate the right iliac fossa. If it's positive, the patient should have pain, or I'm gonna look at the patient's face to check for facial expressions indicating tenderness for appendicitis. And for Rovsing test, I'm gonna palpate the left side of the patient, look at his face again for any facial expression indicating tenderness for the right side. Then I'm gonna move for liver palpation. I'm gonna ask the patient to take a breath and palpate, then ask him to take a breath out, to move to the to move, then palpate again while he takes a breath, and move to check for hepatomegaly. So the patient has no hepatomegaly. And same thing for spleen, but when the spleen enlarges, it goes in an oblique manner. Therefore, I'm going to start from the right side, going over to the left side, palpating, asking the patient to take a breath in, palpate, then move, breath, palpate, then move, until I reach the costal margin of the left side. Then for the gallbladder, the Murphy's sign, I'm gonna go to the costal margin here, ask the patient to take a breath in, palpate, and if it's positive, the patient will have severe pain. Then for the kidneys, I'm gonna put my left hand beneath the back of the patient, the right hand above, and palpate simultaneously for ballotment. Same thing on the other side. For percussion, the liver percussion, mid-clavicular line, I'm going to start from above. Percussion, this should be resonant, 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 until I reach the 5th intercostal space. This is the upper border of the liver, therefore this would be dull. I'm going to move down, percussing, this should be tympanic, 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 until I reach the costal margin. This is the lower surface of the liver, this part is the liver, indicating dullness. This is resonant, and this is tympanic. For the spleen, I'm gonna palpate from the right side to the left. This should all be tympanic until I reach the left costal margin. And then for shifting dullness, I'm gonna palpate. This should be dull if it's positive for ascites, and if it's dull here, I should move the patient while keeping my hand, wait for 15 to 30 seconds, then percuss again. If it moves back to tympanic, this indicates positive shifting dullness. For fluid thrill, I'm gonna put my hand here and now for the auscultations, I'm gonna start performing auscultation for the 4 quadrants, starting at the left lower quadrant, normal bowel sounds, the left upper quadrant, normal bowel sounds, the right upper quadrant, normal bowel sounds, and the right lower quadrant, normal bowel sounds. Then I'm gonna check for the renal artery, half an inch above the umbilicus, half an inch to the left. Performing auscultation for the left renal artery, no brewy sounds, so no swishing, and the same thing on the right renal artery, no brewy sound. And this concludes our local examination. Thank you.
Assalamu alaikum. My name is Abdulaziz Anas Birash. I'm a 3rd year medical student, and I have been instructed to perform a renal examination on you. So this would require exposure of the area. I will first inspect for any abnormalities, and then I will check your hands and arms, your face, neck, and legs. I will move on by palpating and then percussing for any abnormalities. So do I have your consent? So now first I will wash my hands, of course, and next I will make sure that I'm on the patient's right side, and that the patient is lying in a supine position. Now I will start the general inspection. So upon general inspection, the patient does not seem to be in any pain or respiratory distress. There is no pallor, there is no hiccups, the patient is not emitting any fishy smell, and the patient does not have a sallow complexion. The patient is well oriented and conscious, not in a confused mental state. And now to check for dehydration, I will check the patient's mouth for any dry mucous membranes, and then I'll check the patient's eyes for sunken orbits, both which might indicate dehydration. Moving on, I will check the hands and arms of the patients for any leukonesia, which is a white discoloration on the nails. I will check for pallor, I will check for asterexis, which is a flapping tremor. I will ask the patient to extend their hands in a dorsiflex manner, and I will push back. If there is a flapping tremor, then this means it's a positive asterexis. I will check the patient's skin for any skin turgor. I do so by pinching the patient's skin and waiting for the skin to go back. If it takes a long time to go back, that means it is a decreased skin turgor. Lastly, I will check the patient's arms as well for any bruising and scratch marks. And lastly, I will check for arteriovenous fistula, which indicates previous dialysis. Moving on, I will check the patient's face for jaundice, pallor, and I will mention the fundoscopy in the examination. And then I will move on to the patient's neck to check for the common carotid bruit, which is around here in this place. And I will check for the jugular venous pressure level, both of which are normal. Lastly, I will check the patient's legs for any pitting edema in the legs. None are present. And now I will check or inspect the patient's abdomen for scars, any bulge, distension, or ascites, none of which are present. Moving on, now I will begin palpation. So I will palpate the patient's abdomen, all 9 regions, for any tenderness which might indicate peritonitis. You palpate in this fashion. All the 9 regions. Next, I will ballot the kidneys. I do so by laying my left hand below the patient's back in the costovertebral angle, with my right hand above here below the costal margin, and then I will simultaneously push, checking for any ballotment of the kidneys, and do so in this side as well. Lastly, for palpation, I will palpate the suprapubic region below the umbilicus for any bladder enlargement, so in this fashion. And I will percuss the same region for any bladder enlargement as well. Moving on, I will move to detect the presence of ascites. So I do so by percussing the abdomen. Normally, when percussing the abdomen, the sound will be a tympanic sound. But when ascites is suspected, this sound will change into dull. So I will start. Normally, this is a tympanic sound. If ascites is suspected, it will be dull. All the way to the flank regions. And if the flank region is dull, this is suspicion of ascites. So what I do now is I will move the patient to my side without moving my hand, and wait for 15 to 30 seconds for the fluid to move down due to gravity. And then I will palpate or percuss the same region. If the sound changes from dullness to tympanic, this will indicate ascites and shifting dullness. So again, if this changes from dullness to tympanic, this indicates shifting dullness. Moving on, I will now perform the fluid thrill. So I will ask the patient to put his hand on his abdomen to prevent any unwanted vibrations. And I will place my left hand in the flank region here. And from the other flank region, I will just hit. And I will feel for any vibrations that might hit my hand, which also indicates free fluid or ascites. Moving on, I will now perform Murphy's kidney punch. So to perform Murphy's kidney punch, I will ask the patient to sit up. And I will have to inform the patient that I will be lightly punching him. So to perform Murphy's kidney punch, I will have to locate the renal angle, which is below the 12th rib, right around here. of course, the left and right kidney. So below the renal angle, about here, below the 12th rib. So now I will hit the patient, but I have to, of course, warn him. And then the other side. This is now Murphy's kidney punch. So after that, we do Murphy's kidney punch, of course, to elicit any pain which might indicate any kidney stone or kidney abscess. So after performing Murphy's kidney punch, I will now start the auscultation. So using the diaphragm part of the stethoscope, I will auscultate the aorta for any aortic buoy. The aorta will be relative to the umbilicus, just around 1 inch above, so right about here. And I will detect, I will listen for any aortic buoy. An aortic buoy, the sound will be an abnormal swishing or whooshing sound. And after auscultating the aorta, I will auscultate the renal arteries for any renal buoy, which will be, the renal arteries will be 1/2 inch above the umbilicus and then 1/2 inch left and right. So this is approximately the left renal artery. And this is the right renal artery, checking for renal buoy as well. Lastly, to conclude my examination, I will have to mention the examination of the genital and urethral openings, as well as the prostate in males while doing the perirectal method or perirectal examination. And with this, I conclude my examination of the renal examination. Thank you very much.